Hi guys, welcome back to another deep dive into the fascinating world of ancient history. Tonight, we're going to explore something truly remarkable, the sophisticated medical practices of ancient Egypt that laid the foundation for modern medicine as we know it today. We'll journey through the dusty corridors of time to discover how the ancient Egyptians developed surgical techniques, diagnostic methods, and treatments that were thousands of years ahead of their time. From the Edwin Smith papyrus to the mysterious practices of temple healers, we'll uncover the reality behind Egyptian medicine that goes far beyond the popular misconceptions of primitive remedies and superstitious rituals. This isn't just a story about ancient healing, it's about human ingenuity, the pursuit of knowledge, and the timeless desire to heal and be healed. We'll explore the lives of ancient physicians, the medical schools of Memphis and Heliopolis, the intricate process of mummification that taught them anatomy, and the surprising parallels between their practices and modern medical procedures. So settle in for a comprehensive journey that will change how you think about ancient civilizations and their contributions to our modern world. Okay, friends, before you settle in, if you enjoy this kind of deep dive content, then click the like button and don't forget to subscribe. And yes, leave a comment letting me know where you're watching from and what time it is there. I really enjoy seeing where everyone is listening from. Now, dim the lights and turn on the fan, and let's dive into tonight's journey together. The morning sun cast long shadows across the limestone blocks of the Great Pyramid as Haim Wasset made his way through the bustling streets of Memphis. It was the third year of Pharaoh Ramesses II's reign, and the young physician carried with him a leather satchel containing papyrus scrolls, bronze instruments, and various medicinal preparations that would seem remarkably familiar to a modern doctor. The year was approximately 1276 BCE, yet Haim Wasset's understanding of human anatomy, his diagnostic techniques, and his treatment protocols represented the culmination of over 2,000 years of Egyptian medical advancement. The streets of Memphis buzzed with the activity of merchants, craftsmen, and laborers going about their daily routines. But Haim Wasset's mind was focused on the patient he was about to visit. A wealthy merchant named Seneb had sent word that his young son was suffering from what appeared to be a severe head injury sustained in a fall from a roof. As Haim Wasset navigated the narrow alleyways, his fingers traced the familiar outline of his bronze surgical instruments through the leather of his satchel. He had performed similar procedures many times before, each one requiring the precise application of knowledge that had been accumulated and refined over countless generations of Egyptian physicians. The merchant's house was a substantial structure built around a central courtyard, with living quarters on the upper level and storage areas below. Palm trees provided shade from the intense desert sun, and servants moved quietly through the corridors, attending to their duties. Haim Wasset was greeted by Seneb himself, a middle-aged man whose weathered face showed the strain of worry for his injured child. The physician's calm demeanor and confident bearing immediately reassured the anxious father, who led him quickly to the room where the boy lay unconscious. The child, perhaps 10 years of age, lay motionless on a bed of woven linen, his breathing shallow but regular. A large swelling had formed on the left side of his skull, and dried blood matted his dark hair. Chaim Wasset began his examination with the systematic thoroughness that had been drilled into him during his years of training. He first observed the patient's general condition, noting skin color, breathing pattern, and level of consciousness. Then he carefully palpated the injured area, using his fingertips to assess the extent of the damage beneath the swollen tissues. The examination revealed what Chaim Wasset had suspected from the messenger's description. The boy had sustained a depressed skull fracture that was pressing against the brain tissue beneath. Without immediate surgical intervention, the child would likely die or suffer permanent brain damage. The physician explained the situation to the anxious parents, describing the procedure he would need to perform and the risks involved. His calm, professional manner helped reassure the family, even as he made clear the serious nature of the injury. Chaim Wasset began preparing for the surgical procedure, first instructing the household servants to boil water and gather clean linen for bandages. He unpacked his surgical instruments, laying them out on a clean cloth in the precise order he would need them. The bronze tools gleamed in the afternoon light filtering through the window. Sharp knives, curved needles, bone elevators, and drilling devices that had been crafted by skilled metalworkers specifically for medical use. Each instrument had been designed for a specific purpose based on centuries of surgical experience and refinement. Chaim Wasset had trained at the House of Life in Memphis, one of the most prestigious medical schools in the ancient world. His education had been rigorous and comprehensive, involving years of study under master physicians who traced their lineage back to Imhotep himself, the legendary architect and physician who had served Pharaoh Djoser nearly 1,500 years earlier. The medical curriculum at Memphis was surprisingly modern in its approach, emphasizing observation, documentation, and systematic treatment protocols that would not look out of place in a contemporary medical school. The House of Life was more than just a school. It was a complete medical complex that included lecture halls, dissection rooms, libraries, workshops for preparing medicines, and clinical areas where students could observe and participate in patient care. The institution maintained extensive gardens where medicinal plants from throughout the known world were cultivated and studied. Senior physicians conducted regular rounds through the wards, teaching students to recognize symptoms, formulate diagnoses, and develop treatment plans through direct observation of actual cases. The daily routine at the House of Life began before dawn with meditation and purification rituals that prepared the mind and spirit for the sacred work of healing. Students then attended morning lectures where master physicians discussed theoretical principles of medicine, anatomy, and pharmacology. These sessions were interactive, with students expected to ask questions and debate different approaches to treatment. The emphasis was on developing critical thinking skills rather than mere memorization of facts. After the morning lectures, students participated in practical training sessions where they learned to use surgical instruments, prepare medicinal compounds, and practice diagnostic techniques on volunteer patients. The afternoon was devoted to clinical rounds, where students accompanied experienced physicians on visits to patients throughout the complex. These teaching rounds provided invaluable hands-on experience and allowed students to see how theoretical knowledge was applied in real-world situations. The evening hours were spent in the library, where students studied the extensive collection of medical papyri that contained the accumulated wisdom of Egyptian medicine. These texts were carefully preserved and regularly updated with new observations and discoveries. Students were required to copy important passages as part of their education, a practice that not only helped them memorize essential information, but also contributed to the preservation and transmission of medical knowledge. The selection process for admission to the House of Life was highly competitive, with candidates evaluated based on their intellectual ability, moral character, and dedication to the healing arts. Most students came from families with existing connections to the medical profession, but exceptional candidates from other backgrounds were occasionally accepted based on demonstrated aptitude and commitment. The training program lasted approximately 10 years, with students progressing through increasingly advanced levels of study and responsibility. During their first 2 years, students focused primarily on basic sciences, learning anatomy, physiology, and the properties of medicinal substances. They spent countless hours in the dissection halls, studying preserved specimens and observing the intricate structures of the human body. This anatomical foundation was considered essential for any physician, regardless of their intended specialty or area of practice. The third and fourth years emphasized diagnostic skills and clinical observation. Students learned to recognize the signs and symptoms of various diseases, to conduct systematic physical examinations, and to interpret the significance of different clinical findings. They studied the great medical papyri in detail, learning to apply the diagnostic principles and treatment protocols described in these ancient texts to contemporary cases. The fifth and sixth years involved intensive training in pharmacology and therapeutics. Students learned to identify, harvest, and prepare hundreds of different medicinal substances. They studied the proper dosages for different preparations, the methods for combining multiple ingredients to create complex remedies, and the techniques for modifying treatments based on individual patient characteristics. This training included extensive work in the medicinal gardens, where students learned to recognize plants in their natural state and to understand the optimal times for harvesting different species. The final 4 years of training involved specialized study in one or more areas of medical practice. Students could choose to focus on surgery, internal medicine, gynecology, pediatrics, or other specialized fields. This advanced training included serving as apprentices to master physicians, taking increasing responsibility for patient care under careful supervision. By the time they completed their education, new physicians had accumulated years of practical experience in addition to their theoretical knowledge. The foundation of Egyptian medicine rested upon an extensive collection of medical papyri that served as textbooks, reference manuals, and case studies for practicing physicians. The most famous of these, the Edwin Smith Papyrus, contained detailed descriptions of surgical procedures and anatomical observations that demonstrated an understanding of the human body that wouldn't be surpassed in Europe for over 2 millennia. This papyrus, dating to around 1600 BCE, but containing knowledge that was already ancient at that time, described 48 different surgical cases with remarkable precision and clinical objectivity. What made the Edwin Smith Papyrus so extraordinary was its rational, scientific approach to medicine. Unlike many contemporary medical texts that relied heavily on supernatural explanations and magical incantations, this document approached medical problems with systematic observation and logical reasoning. Each case was presented with a title describing the injury or condition, followed by a detailed examination procedure, a diagnosis, and a treatment plan. The language was technical and precise, using anatomical terms that demonstrated a sophisticated understanding of human physiology. The papyrus was organized in a systematic fashion, progressing from head injuries down through the body in anatomical order. This organization reflected the methodical approach that characterized Egyptian medical thinking. Each case description began with a standardized formula that established the clinical context and then proceeded through a logical sequence of examination findings, diagnostic considerations, and treatment recommendations. The consistency of this format suggested that Egyptian physicians had developed standardized protocols for clinical evaluation and documentation. The terminology used in the Edwin Smith Papyrus was remarkably sophisticated, employing specific anatomical terms for different body structures and precise descriptions of pathological processes. The text distinguished between different types of wounds, fractures, and dislocations, using consistent vocabulary that indicated a well-developed medical language. This specialized terminology allowed physicians to communicate complex medical concepts with precision and clarity, facilitating the transmission of knowledge between practitioners and across generations. One of the most striking features of the papyrus was its honest assessment of treatment outcomes. The text categorized cases into 3 groups: those that could be treated successfully, those that were treatable but with uncertain outcomes, and those that were untreatable with available methods. This frank acknowledgement of medical limitations demonstrated a mature understanding of the boundaries of medical knowledge and a commitment to honest evaluation of therapeutic effectiveness. The surgical procedures described in the Edwin Smith Papyrus were accompanied by detailed anatomical observations that revealed an impressive understanding of human structure and function. The text described the layers of the scalp, the structure of the skull, and the appearance of brain tissue with accuracy that would not be surpassed for many centuries. These observations were clearly based on direct examination of human specimens, indicating that Egyptian physicians had extensive experience with anatomical dissection. The papyrus also contained the world's first known descriptions of several neurological phenomena, including the relationship between brain injury and paralysis, the significance of different types of skull fractures, and the prognostic importance of various neurological signs. These observations demonstrated that Egyptian physicians had developed a sophisticated understanding of nervous system function based on careful clinical observation and correlation of symptoms with anatomical findings. The treatment protocols described in the Edwin Smith Papyrus emphasized the importance of wound cleaning, proper positioning of injured parts, and the use of appropriate dressings and medications. The text provided detailed instructions for suturing techniques, splinting methods, and post-operative care that demonstrated a comprehensive understanding of surgical principles. These protocols were clearly based on extensive clinical experience and represented the accumulated wisdom of many generations of Egyptian surgeons. The pharmacological preparations mentioned in the papyrus included a wide variety of substances derived from plants, animals, and minerals. These remedies were often complex formulations that combined multiple ingredients, suggesting that Egyptian physicians had developed sophisticated methods for creating therapeutic compounds. The text provided specific instructions for preparation methods, dosages, and routes of administration that indicated a mature understanding of pharmacological principles. The diagnostic methods described in the papyrus emphasized the importance of systematic observation and logical reasoning in medical practice. Physicians were instructed to examine patients carefully, to correlate physical findings with symptoms, and to base their diagnoses on objective evidence rather than speculation. This empirical approach to diagnosis represented a significant advancement over earlier medical traditions that relied primarily on supernatural explanations for disease. The papyrus revealed that Egyptian physicians understood the relationship between the heart and the circulatory system, recognizing that the pulse could be felt at various points throughout the body and that it was connected to cardiac function. They knew that the brain controlled bodily functions and that damage to specific areas of the brain could result in paralysis or loss of function in corresponding parts of the body. This neurological knowledge was particularly remarkable given that most ancient cultures, including the Greeks, believed that the heart was the seat of intelligence and consciousness. Egyptian physicians had developed a comprehensive understanding of the skeletal system, identifying and naming virtually every bone in the human body. They understood the mechanics of joints, the healing process of fractures, and the importance of proper alignment in bone repair. Their surgical instruments included bone saws, chisels, and drilling devices that allowed them to perform complex orthopedic procedures. Archaeological evidence has revealed numerous examples of successfully healed fractures, indicating that Egyptian surgeons possessed considerable skill in treating traumatic injuries. The practice of mummification, while primarily religious in purpose, provided Egyptian physicians with unparalleled opportunities to study human anatomy. The careful removal and preservation of organs during the mummification process required intimate knowledge of internal anatomy and surgical technique. The embalmers, who were often closely associated with the medical community, developed sophisticated methods for accessing internal organs while minimizing damage to surrounding tissues. This hands-on experience with human dissection gave Egyptian physicians a level of anatomical knowledge that would not be matched in Europe until the Renaissance. The relationship between embalmers and physicians was complex and mutually beneficial. While embalmers were primarily concerned with the religious and practical aspects of body preservation, their work required detailed anatomical knowledge that overlapped significantly with medical practice. Many embalmers received training in anatomy and surgical techniques that paralleled medical education, and some practitioners worked in both fields throughout their careers. This cross-training ensured that anatomical knowledge gained through mummification was readily available to the medical community. The embalming process itself was a carefully choreographed procedure that varied depending on the social status and wealth of the deceased. The most elaborate mummifications, reserved for pharaohs and the wealthy elite, involved extensive surgical procedures that provided valuable learning opportunities for medical practitioners. The removal of internal organs required precise incisions and careful dissection techniques that closely resembled surgical procedures performed on living patients. The preservation techniques developed by Egyptian embalmers were remarkably sophisticated, involving the use of various chemical agents and physical methods to prevent decay and maintain tissue integrity. The embalmers had extensive knowledge of the properties of different preservation substances, including natron salt, various oils and resins, and aromatic compounds. This chemical knowledge was directly applicable to medical practice, where similar substances were used for wound treatment and infection control. The study of mummified remains has provided modern scholars with valuable insights into ancient Egyptian anatomical knowledge and medical practices. Well-preserved mummies show evidence of successful surgical procedures, including bone setting, wound repair, and even complex operations like trepanation.
These findings have confirmed many of the claims made in ancient medical texts and have revealed additional information about the sophistication of Egyptian medical practice.
The embalmers' workshops were centers of anatomical learning, where medical students could observe dissection procedures and study the internal structure of the human body. These workshops maintained collections of preserved specimens that served as teaching aids for medical education. The availability of human specimens for study gave Egyptian medical students a significant advantage over their counterparts in other cultures, where religious or cultural prohibitions limited opportunities for anatomical investigation. The techniques developed for brain removal during mummification were particularly sophisticated and required considerable skill and anatomical knowledge. The embalmers used long bronze instruments to extract brain tissue through the nasal cavity, a procedure that required precise movements to avoid damaging the skull or facial structures. This technique demonstrated an intimate understanding of cranial anatomy and provided valuable experience with procedures that were applicable to medical treatment of head injuries. The careful documentation maintained by embalmers included detailed records of their procedures, observations about anatomical variations, and notes about pathological conditions discovered during the embalming process. These records were often shared with the medical community and contributed to the overall body of anatomical and pathological knowledge available to Egyptian physicians. The collaborative relationship between embalmers and physicians created a unique environment for the advancement of medical knowledge. The preservation of soft tissues during mummification allowed for detailed study of organ structure and function that would not have been possible with skeletal remains alone. The embalmer's knowledge of organ location, size, and appearance was directly applicable to medical diagnosis and treatment. This anatomical knowledge was particularly valuable for understanding internal diseases and developing surgical approaches to various medical conditions. The mummification process itself was a complex procedure that took approximately 70 days to complete. The body was first washed and purified. Then the internal organs were carefully removed through small incisions. The brain was extracted through the nasal cavity using long bronze instruments, a procedure that required considerable skill and anatomical knowledge. The heart was typically left in place, as it was considered the seat of intelligence and would be needed in the afterlife. The liver, lungs, stomach, and intestines were removed, treated with natron salt, and placed in canopic jars for separate preservation. The initial preparation of the body involved extensive washing and purification rituals that served both religious and practical purposes. The body was cleansed with palm wine and various aromatic substances that helped remove surface contamination and began the preservation process. This initial cleaning was followed by the careful positioning of the body and the marking of incision sites by experienced embalmers who had intimate knowledge of human anatomy. The removal of internal organs required exceptional skill and precision, as embalmers had to access internal cavities while minimizing damage to surrounding structures. The abdominal incision was typically made on the left side of the body, following anatomical landmarks that had been established through generations of practice. The embalmers used specialized instruments to carefully separate organs from their attachments and remove them intact for separate treatment. The brain extraction procedure was one of the most technically challenging aspects of mummification, requiring the use of long hooked instruments to break up brain tissue and remove it through the relatively small nasal opening. This procedure required detailed knowledge of cranial anatomy and considerable manual dexterity to avoid damaging the skull or facial structures. The successful completion of this procedure was considered a mark of exceptional skill among embalmers. The treatment of removed organs involved complex preservation procedures that varied depending on the specific organ and the desired level of preservation. The organs were first cleaned and dried, then treated with various preservative substances, including natron salt, aromatic resins, and oils. Each organ required specific treatment protocols that had been developed through extensive experimentation and experience. The canopic jars used for organ storage were specialized containers designed to protect and preserve the treated organs for eternity. These jars were typically made from limestone or ceramic materials and featured distinctive lids that represented the 4 sons of Horus, each associated with a specific organ. The jars were carefully sealed and often inscribed with protective spells and identification information. The body cavity treatment involved thorough cleaning and disinfection procedures, followed by the application of various preservative substances. The empty cavities were washed with palm wine and aromatic solutions, then packed with temporary materials while the body underwent the lengthy drying process. This treatment helped prevent decay and maintained the structural integrity of the body throughout the mummification process. The natron salt treatment was the cornerstone of Egyptian preservation techniques, involving the complete coverage of the body with this naturally occurring mineral salt for a period of approximately 40 days. The natron drew moisture from the tissues while providing antimicrobial effects that prevented bacterial growth and decay. The amount and quality of natron used varied depending on the status of the deceased and the resources available for the mummification process. The drying process required careful monitoring and periodic adjustment to ensure optimal results. Embalmers regularly checked the progress of desiccation and made adjustments to the natron coverage as needed. The body was typically repositioned several times during the drying period to ensure even treatment and prevent the development of pressure sores or other irregularities. The final preparation stages involved the careful cleaning of the dried body, the replacement of temporary packing materials with permanent preservative substances, and the beginning of the wrapping process. The body cavities were filled with sawdust, linen, or other materials soaked in preservative resins. The eyes were sometimes replaced with artificial substitutes, and various cosmetic treatments were applied to restore a lifelike appearance. The Egyptian understanding of pharmacology was equally impressive. They had identified and cataloged hundreds of medicinal plants, minerals, and animal products, creating an extensive pharmacopoeia that included detailed instructions for preparation and administration. Many of these remedies have been validated by modern scientific research, demonstrating that Egyptian physicians had developed effective treatments through careful observation and experimentation. The development of Egyptian pharmacology was a gradual process that spanned thousands of years, with each generation of physicians building upon the knowledge of their predecessors. The earliest medical practitioners began by observing the effects of various substances on human health, noting which plants seemed to alleviate symptoms and which appeared to cause harm. Through systematic experimentation and careful documentation, they gradually assembled a comprehensive understanding of medicinal properties and therapeutic applications. The collection and preparation of medicinal substances was a complex process that required specialized knowledge and considerable skill. Egyptian physicians had to understand the optimal times for harvesting different plants, the proper methods for processing various materials, and the techniques for combining multiple ingredients to create effective therapeutic compounds. This knowledge was carefully guarded and transmitted through apprenticeship relationships that ensured the preservation of pharmaceutical secrets across generations. The medicinal gardens maintained by Egyptian medical institutions were marvels of botanical organization and horticultural expertise. These gardens contained specimens of healing plants from throughout the known world, carefully cultivated and maintained by skilled gardeners who worked closely with medical practitioners. The gardens served both as sources of medicinal materials and as living laboratories where physicians could study plant properties and experiment with new therapeutic applications. The classification system used by Egyptian pharmacologists was remarkably sophisticated, organizing medicinal substances according to their therapeutic properties, methods of preparation, and clinical applications. This system allowed physicians to quickly identify appropriate treatments for specific conditions and facilitated the teaching of pharmaceutical knowledge to medical students. The classification system also helped ensure consistency in the preparation and administration of medicinal compounds. The quality control measures implemented by Egyptian pharmacologists were surprisingly rigorous, involving standardized procedures for testing the potency and purity of medicinal preparations. Physicians developed methods for evaluating the freshness of plant materials, the concentration of active compounds in various preparations, and the stability of complex formulations over time. These quality control measures helped ensure that patients received effective treatments and minimized the risk of adverse reactions. The dosage calculations used by Egyptian physicians demonstrated a sophisticated understanding of pharmacological principles, including concepts that would not be formally recognized by Western medicine until much later. They understood that effective dosages varied based on patient size, age, and condition, and they developed methods for adjusting treatments accordingly. Their dosage calculations also took into account the potency of different preparations and the route of administration. The methods used for drug administration were diverse and sophisticated, including oral preparations, topical applications, inhalations, enemas, and even primitive forms of injection. Each route of administration was chosen based on the nature of the condition being treated and the properties of the therapeutic substance being used. The variety of administration methods available to Egyptian physicians allowed them to tailor treatments to individual patient needs and circumstances. The Egyptian pharmaceutical industry was well organized and regulated, with established standards for the training of pharmacologists, the preparation of medicinal compounds, and the distribution of therapeutic substances. Specialized workshops produced standardized preparations that were distributed throughout the Egyptian medical system, ensuring consistency in treatment quality and availability. These workshops also served as centers for pharmaceutical research and development. The documentation maintained by Egyptian pharmacologists was extensive and detailed, including comprehensive catalogs of medicinal substances, detailed preparation instructions, and careful records of treatment outcomes. This documentation served as a reference system for practicing physicians and as a teaching resource for medical students. The systematic approach to pharmaceutical documentation contributed significantly to the advancement and preservation of medical knowledge. Willow bark, which contains salicin, a precursor to aspirin, was commonly used by Egyptian physicians to treat pain and inflammation. They understood that this remedy was particularly effective for headaches and joint pain, and they had developed standardized methods for preparing and dosing willow bark extracts. Garlic was prescribed for its antimicrobial properties, and modern research has confirmed that garlic contains powerful antibiotic compounds. Honey was used both as a wound dressing and as an internal medicine, and contemporary studies have demonstrated honey's effectiveness as an antimicrobial agent and its ability to promote wound healing. The preparation of willow bark medications involved complex processes that maximized the extraction of active compounds while minimizing potential side effects. The bark was typically harvested from young willow trees during specific seasons when the concentration of active compounds was highest. The harvested bark was then dried, ground, and processed using various extraction methods that had been refined through generations of pharmaceutical practice. The dosage protocols for willow bark preparations were carefully calibrated based on patient characteristics, symptom severity, and desired therapeutic outcomes. Egyptian physicians had developed standardized measurement systems that ensured consistent dosing across different practitioners and treatment settings. The medications were typically administered as teas, powders, or concentrated extracts, with each form requiring specific preparation and administration techniques. The quality control measures applied to willow bark medications included careful evaluation of raw materials, standardized preparation procedures, and systematic testing of finished products. Pharmacologists developed methods for assessing the potency and purity of willow bark preparations, ensuring that patients received effective treatments. Storage and preservation techniques were employed to maintain medication quality over extended periods. The therapeutic applications of garlic in Egyptian medicine extended far beyond simple antimicrobial uses, encompassing treatments for respiratory conditions, digestive disorders, and cardiovascular problems. Physicians had observed that regular garlic consumption seemed to promote overall health and longevity, leading to its inclusion in various preventive medicine protocols. The preparation methods for garlic medications varied depending on the intended use and included fresh preparations, dried powders, and concentrated extracts. The antimicrobial properties of garlic were recognized through careful observation of its effects on wound healing and infection prevention. Egyptian physicians noted that wounds treated with garlic preparations healed faster and showed fewer signs of infection compared to untreated wounds. This observation led to the systematic incorporation of garlic into various wound care protocols and antiseptic preparations. The cultivation of medicinal garlic required specialized agricultural techniques that ensured optimal potency and therapeutic effectiveness. Egyptian farmers developed methods for growing garlic varieties with enhanced medicinal properties, including specific soil preparation techniques, planting schedules, and harvesting methods. The selection and breeding of superior garlic varieties contributed to the overall effectiveness of garlic-based medications. The honey used in Egyptian medicine was carefully sourced from specific regions and flower sources that were known to produce honey with superior therapeutic properties. Different types of honey were recognized as having different medicinal effects, leading to the development of specialized honey varieties for specific therapeutic applications. The processing and purification of medicinal honey involved sophisticated techniques that preserved therapeutic compounds while removing potential contaminants. The wound-healing properties of honey were well documented in Egyptian medical practice, with detailed protocols for honey-based wound dressings and treatment procedures. Physicians had developed various honey preparations that combined honey with other therapeutic substances to create enhanced wound healing compounds. The application techniques for honey-based treatments were carefully standardized to ensure optimal therapeutic outcomes. The antimicrobial mechanisms of honey were not fully understood by Egyptian physicians, but they had observed and documented its effectiveness through systematic clinical experience. They noted that honey-treated wounds showed reduced signs of infection, faster healing times, and better cosmetic outcomes compared to other treatments. This empirical evidence led to the widespread adoption of honey-based treatments throughout Egyptian medical practice. The preservation and storage of medicinal honey required specialized techniques that maintained its therapeutic properties while preventing deterioration. Egyptian pharmacologists developed methods for testing honey quality, identifying adulterated products, and ensuring the long-term stability of honey-based preparations. These quality assurance measures were essential for maintaining the effectiveness of honey-based treatments. The Ebers Papyrus, another major medical text dating to around 1550 BCE, contained over 870 prescriptions and remedies for various ailments. This comprehensive pharmacological reference demonstrated the sophisticated chemical knowledge of Egyptian physicians who had learned to extract active compounds from plants, combine multiple ingredients for enhanced effectiveness, and modify dosages based on patient characteristics and severity of symptoms. The papyrus included detailed instructions for treating everything from minor cuts and bruises to complex internal disorders. Egyptian physicians recognized the importance of hygiene and preventive medicine, implementing public health measures that would be considered advanced even by modern standards. They understood the connection between sanitation and disease, establishing elaborate systems for waste disposal and water purification. Egyptian cities featured sophisticated drainage systems, public latrines, and regulations governing food preparation and storage. The wealthy employed personal physicians who emphasized dietary guidelines, exercise recommendations, and lifestyle modifications to maintain health and prevent disease. The public health infrastructure developed in ancient Egypt was remarkably comprehensive and well organized. Egyptian cities were planned with careful attention to sanitation needs, incorporating drainage systems that carried waste away from residential areas and into the Nile River or designated disposal sites. These drainage systems included both covered sewers for liquid waste and organized collection systems for solid refuse that prevented the accumulation of garbage in populated areas. The water supply systems developed by Egyptian engineers ensured that clean drinking water was available throughout major cities and towns. These systems included elaborate networks of canals, aqueducts, and storage facilities that brought fresh water from the Nile to residential and commercial areas. Water quality was monitored by designated officials who ensured that supplies remained free from contamination and suitable for human consumption. The food safety regulations implemented by Egyptian authorities were surprisingly sophisticated and comprehensive. These regulations covered all aspects of food production, processing, storage, and distribution, establishing standards for cleanliness, quality control, and proper handling procedures. Markets and food vendors were regularly inspected by designated officials who had the authority to confiscate contaminated products and impose penalties on vendors who violated health regulations. The personal hygiene practices promoted by Egyptian physicians included detailed guidelines for bathing, dental care, and grooming that reflected an understanding of the relationship between cleanliness and health. Wealthy Egyptians typically bathed daily using scented soaps and oils, while even common people were expected to maintain basic standards of cleanliness. Dental hygiene was particularly emphasized, with various preparations available for cleaning teeth and treating oral health problems. The occupational health measures implemented in Egyptian workplaces demonstrated an understanding of the relationship between working conditions and worker health. Construction sites, workshops, and other industrial facilities incorporated safety features designed to protect workers from injury and exposure to harmful substances. Work schedules were organized to prevent excessive fatigue, and medical care was provided for workers who sustained injuries or developed occupational illnesses. The environmental health measures implemented by Egyptian authorities addressed various factors that could affect community health, including air quality, noise control, and the management of industrial waste. Regulations governed the location of industries that produced smoke or other pollutants, ensuring that these facilities were situated downwind from residential areas. Similar attention was paid to controlling noise levels and managing the disposal of industrial byproducts. The health education programs developed by Egyptian physicians provided communities with practical information about disease prevention and health maintenance. These programs included instruction in proper hygiene practices, dietary guidelines, and recognition of disease symptoms that required medical attention. The education was provided through various channels, including formal instruction in schools, public announcements in markets, and individual counseling by physicians. The quarantine procedures implemented during disease outbreaks demonstrated an understanding of contagion, and the importance of isolating affected individuals to prevent further spread. These procedures included the establishment of isolation facilities, the restriction of movement from affected areas, and the implementation of disinfection procedures for contaminated materials. The effectiveness of these measures contributed to the control of various epidemic diseases. The health monitoring systems developed by Egyptian authorities provided early warning of potential health threats and enabled rapid response to emerging problems. These systems included regular health surveys of the population, monitoring of disease patterns, and surveillance of environmental conditions that might affect public health. The information gathered through these monitoring systems was used to guide public health policy and resource allocation decisions. The diagnostic techniques employed by Egyptian physicians were remarkably sophisticated and systematic. They had developed standardized examination procedures that included visual inspection, palpation, auscultation, and even primitive forms of laboratory testing. Physicians were trained to observe skin color, texture, and temperature, to feel for abnormal masses or swelling, to listen to breathing patterns and heart rhythms, and to examine bodily fluids for signs of disease. The visual examination techniques used by Egyptian physicians were comprehensive and methodical, involving careful observation of the patient's general appearance, posture, movement, and demeanor. Physicians were trained to recognize subtle changes in skin color that might indicate various disease states, to identify abnormal growths or lesions, and to assess the patient's overall nutritional status and level of distress. This visual assessment provided valuable information that guided subsequent examination procedures. The palpation techniques developed by Egyptian physicians were sophisticated and precise, involving the systematic examination of different body regions using specific hand positions and pressure techniques. Physicians learned to detect enlarged organs, abnormal masses, areas of tenderness, and changes in tissue texture or consistency. They also developed methods for assessing pulse quality at various anatomical locations, providing information about cardiovascular function and general health status. The auscultation techniques used by Egyptian physicians, while primitive compared to modern methods, were nevertheless systematic and informative. Physicians learned to listen to breathing sounds, heart rhythms, and intestinal activity by placing their ears directly against the patient's body. They could distinguish between normal and abnormal sounds and used these auditory findings to help formulate diagnoses and assess treatment effectiveness. The laboratory techniques available to Egyptian physicians included various methods for analyzing bodily fluids and other specimens. They developed procedures for examining urine, blood, sputum, and other secretions, looking for changes in color, consistency, odor, and other characteristics that might indicate disease. While their understanding of the underlying mechanisms was limited, their observational skills were keen, and their correlations between laboratory findings and clinical conditions were often accurate. The systematic approach to patient evaluation used by Egyptian physicians involved a standardized sequence of examination procedures that ensured comprehensive assessment of each case. This systematic approach reduced the likelihood of overlooking important findings and facilitated the comparison of cases for research and educational purposes. The standardization of examination procedures also improved the consistency and reliability of diagnostic assessments. The documentation methods used by Egyptian physicians were detailed and systematic, involving the careful recording of examination findings, diagnostic impressions, and treatment plans. These records served multiple purposes, including tracking patient progress, evaluating treatment effectiveness, and preserving clinical knowledge for future reference. The systematic documentation practices developed by Egyptian physicians provided a foundation for evidence-based medical practice. The differential diagnosis techniques used by Egyptian physicians involved the systematic consideration of multiple possible explanations for a patient's symptoms and findings. Physicians were trained to generate lists of potential diagnoses and to use additional examination procedures and tests to distinguish between different possibilities. This analytical approach to diagnosis represented a sophisticated level of clinical reasoning that was far advanced for its time. The prognostic methods developed by Egyptian physicians allowed them to make informed predictions about the likely course and outcome of various medical conditions. These predictions were based on careful observation of similar cases over time and the recognition of patterns that indicated favorable or unfavorable outcomes. The ability to provide accurate prognoses was highly valued by patients and families and contributed to the reputation and credibility of Egyptian physicians. The consultation procedures used by Egyptian physicians facilitated collaboration between practitioners and ensured that complex cases received appropriate attention from multiple specialists. Physicians regularly sought second opinions from colleagues, participated in case discussions, and referred patients to specialists when indicated. This collaborative approach to medical practice improved patient outcomes and contributed to the advancement of medical knowledge through shared experience and expertise. The ancient Egyptians recognized that urine could provide valuable diagnostic information, developing methods for analyzing color, clarity, and even taste to identify various medical conditions. They understood that certain diseases produced characteristic changes in urine appearance and had cataloged these findings for diagnostic purposes. Similarly, they examined sputum, blood, and other bodily secretions for diagnostic clues, demonstrating a systematic approach to clinical investigation that paralleled modern medical practice. The urine analysis techniques developed by Egyptian physicians were surprisingly sophisticated and comprehensive, involving systematic observation of multiple physical characteristics that could indicate various disease states. Physicians were trained to examine urine samples immediately upon collection, as they understood that certain diagnostic indicators could change rapidly after specimen collection. The examination procedures included assessment of color variations, clarity or cloudiness, odor characteristics, and even foam formation patterns. The color variations observed in urine were systematically cataloged and correlated with specific medical conditions based on extensive clinical experience. Egyptian physicians recognized that dark yellow urine might indicate fever or dehydration, while reddish coloration could suggest bleeding or certain diseases. Pale or clear urine was associated with different conditions than concentrated, dark samples. These color correlations formed the basis for a comprehensive diagnostic system that guided treatment decisions. The clarity assessment of urine samples provided additional diagnostic information that complemented color analysis. Physicians noted whether urine samples were clear, cloudy, or contained visible particles or sediment. They understood that cloudy urine might indicate infection or inflammation, while certain types of particles could suggest kidney stones or other urinary tract disorders. The systematic documentation of clarity findings contributed to diagnostic accuracy. The odor characteristics of urine samples were carefully evaluated as part of the diagnostic process, with physicians trained to recognize distinctive smells that might indicate specific medical conditions. Sweet-smelling urine was noted in certain patients, though the connection to what we now know as diabetes was not fully understood. Strong, unpleasant odors were associated with infections or other pathological conditions. The systematic attention to odor characteristics demonstrated the comprehensive nature of Egyptian diagnostic methods. The taste testing of urine samples, while unusual by modern standards, provided valuable diagnostic information that was carefully integrated into the overall clinical assessment. Physicians were trained to recognize sweet, bitter, salty, or other taste characteristics that might indicate various disease states. This practice required considerable skill and experience to perform safely and interpret accurately. The information gained through taste testing was combined with other diagnostic findings to formulate comprehensive diagnostic impressions. The examination of sputum and other respiratory secretions provided important diagnostic information about lung and respiratory tract conditions. Physicians evaluated the color, consistency, volume, and odor of sputum samples to assess the nature and severity of respiratory diseases. They understood that bloody sputum might indicate serious lung disease, while purulent secretions suggested infection. The systematic analysis of respiratory secretions contributed to more accurate diagnoses and treatment of respiratory conditions. The blood examination techniques available to Egyptian physicians included visual assessment of blood samples obtained through various means. They evaluated blood color, consistency, clotting characteristics, and other observable features that might provide diagnostic information. While their understanding of blood physiology was limited compared to modern knowledge, their careful observations often provided valuable clinical insights that guided treatment decisions. The systematic documentation of laboratory findings was an important aspect of Egyptian diagnostic practice, with physicians maintaining detailed records of their observations and correlating these findings with clinical outcomes. This documentation served both immediate diagnostic purposes and long-term research goals, contributing to the accumulation of medical knowledge and the refinement of diagnostic techniques. The quality control measures applied to laboratory procedures included standardized collection techniques, proper specimen handling, and systematic examination protocols that ensured reliable and reproducible results. Physicians were trained in proper specimen collection methods and examination procedures that minimized the risk of contamination or misinterpretation. These quality assurance measures contributed to the accuracy and reliability of diagnostic assessments. The integration of laboratory findings with clinical examination results demonstrated the comprehensive nature of Egyptian diagnostic practice. Physicians understood that laboratory results should be interpreted in the context of overall clinical presentation, and they developed systematic methods for combining multiple types of diagnostic information to formulate accurate diagnoses. This integrated approach to diagnosis represented a sophisticated understanding of clinical investigation that paralleled modern medical practice. Egyptian physicians were skilled surgeons who performed a wide range of procedures with remarkable success rates. Archaeological evidence has revealed numerous examples of successful surgical interventions, including trepanation, cataract removal, and complex wound repair. The surgical instruments recovered from Egyptian sites demonstrate sophisticated metallurgy and precision manufacturing, producing tools that were both functional and durable. The surgical training provided to Egyptian physicians was comprehensive and rigorous, involving years of instruction in anatomy, surgical techniques, and post-operative care. Students began their surgical education by observing experienced surgeons during operations, gradually taking on increasing responsibility as their skills developed. The training process emphasized the importance of precise technique, sterile procedure, and careful attention to anatomical detail. The operating environments used by Egyptian surgeons were carefully prepared and maintained to promote successful outcomes. Surgical procedures were typically performed in dedicated areas that could be thoroughly cleaned and organized for optimal working conditions. The Egyptians understood the importance of cleanliness in surgical practice, implementing procedures for sterilizing instruments and maintaining aseptic conditions during operations. The pre-operative preparation procedures used by Egyptian surgeons were thorough and systematic, involving careful patient assessment, detailed planning of the surgical approach, and preparation of all necessary instruments and materials. Surgeons took time to explain procedures to patients and their families, obtaining consent and providing realistic expectations about outcomes and recovery. This comprehensive preoperative preparation contributed significantly to surgical success rates. The anesthesia techniques available to Egyptian surgeons, while primitive by modern standards, were nevertheless effective for many types of procedures. They used various plant-based preparations that contained analgesic and sedative compounds, including opium derivatives and other psychoactive substances. These anesthetic agents were administered orally or by inhalation and provided sufficient pain relief for many surgical interventions. The surgical techniques developed by Egyptian surgeons were sophisticated and precise, involving careful incision placement, meticulous tissue handling, and systematic approaches to various types of operations. They developed specialized procedures for different anatomical regions and types of conditions, with each procedure refined through generations of practice and improvement. The techniques were documented in medical papyri and transmitted through apprenticeship relationships. The post-operative care provided by Egyptian surgeons was comprehensive and systematic, involving careful monitoring of patient recovery, management of pain and complications, and gradual rehabilitation as healing progressed. Surgeons understood the importance of proper wound care, appropriate positioning, and gradual resumption of activity in promoting successful recovery. The attention to post-operative care contributed significantly to the overall success rates of Egyptian surgical practice. The surgical instruments used by Egyptian surgeons were manufactured to precise specifications and maintained in excellent condition. The instruments were made from high-quality bronze and other metals, carefully shaped and sharpened for specific purposes.
The variety and sophistication of these instruments reflected the advanced state of Egyptian surgical practice and the high standards maintained by Egyptian craftsmen. The surgical specialization that developed within Egyptian medicine allowed surgeons to focus on particular types of procedures and develop exceptional skill in their chosen areas of practice. Some surgeons specialized in orthopedic procedures, others in soft tissue surgery, and still others in specialized procedures like cataract removal or trepanation. This specialization improved outcomes and allowed for the development of increasingly sophisticated surgical techniques. The documentation of surgical procedures and outcomes maintained by Egyptian surgeons provided valuable information for improving techniques and training future practitioners. Surgeons kept detailed records of their cases, noting the procedures performed, complications encountered, and long-term outcomes achieved. This systematic documentation contributed to the advancement of surgical knowledge and the refinement of operative techniques. Trepanation, the surgical removal of skull bone, was performed by Egyptian surgeons for both medical and ritual purposes. Medical trepanation was used to treat head injuries, relieve intracranial pressure, and remove bone fragments from traumatic wounds. The procedure required considerable skill and anatomical knowledge, as the surgeon had to penetrate the skull without damaging underlying brain tissue. Archaeological evidence suggests that many patients survived this procedure, indicating that Egyptian surgeons had developed effective techniques for minimizing complications and promoting healing. Cataract surgery was another area of Egyptian surgical expertise. Physicians had learned to identify cataracts as a cause of blindness and had developed techniques for removing or displacing the clouded lens to restore vision. This procedure required precise hand movements and specialized instruments, demonstrating the high level of surgical skill achieved by Egyptian physicians. The success of these procedures is evidenced by artistic depictions and textual descriptions that reference the restoration of sight through surgical intervention. The treatment of wounds and injuries was a particular strength of Egyptian medicine. Physicians had developed sophisticated techniques for cleaning wounds, controlling bleeding, preventing infection, and promoting healing. They understood the importance of wound irrigation and had developed various solutions for cleansing injuries. Honey, which has natural antimicrobial properties, was commonly used as a wound dressing, often combined with other substances to create complex therapeutic preparations. Egyptian physicians recognized different types of wounds and had developed specific treatment protocols for each category. They distinguished between clean cuts, puncture wounds, burns, and infected wounds, adapting their treatment approaches accordingly. The Edwin Smith Papyrus described detailed procedures for suturing wounds, including different types of stitches and closure techniques appropriate for various anatomical locations and wound characteristics. The ancient Egyptians had developed a sophisticated understanding of dentistry and oral health. Dental problems were common in ancient Egypt due to the abrasive nature of their diet, which included bread made from stone-ground grain that wore down teeth and caused dental decay. Egyptian physicians developed various treatments for tooth pain, dental abscesses, and gum disease, creating one of the world's first specialized dental practices.
The dietary factors that contributed to dental problems in ancient Egypt were well understood by physicians, who recognized the connection between food choices and oral health outcomes. The stone-ground grain used to make bread contained particles of sand and stone that acted as abrasives, gradually wearing away tooth enamel and exposing the underlying tooth structure to decay. The high carbohydrate content of the Egyptian diet also contributed to tooth decay by providing nutrients for harmful oral bacteria. The dental examination techniques developed by Egyptian physicians were systematic and comprehensive, involving careful visual inspection of teeth and gums, palpation of swollen areas, and assessment of tooth mobility and sensitivity. Physicians were trained to recognize the early signs of dental decay, gum disease, and other oral health problems that might require intervention. The thorough nature of dental examinations helped ensure that problems were identified and treated before they became severe. The pain management techniques available for dental procedures included the use of various topical and systemic medications that provided analgesic effects. Local applications of numbing substances were used to reduce sensitivity during dental procedures, while systemic pain medications helped manage discomfort associated with dental infections and other oral health problems. The effectiveness of these pain management techniques allowed Egyptian dentists to perform more complex procedures with greater patient comfort. The treatment of dental abscesses required considerable skill and knowledge of oral anatomy, as these infections could be life-threatening if not properly managed. Egyptian physicians developed systematic approaches to abscess treatment that included drainage procedures, antimicrobial medications, and supportive care measures. The recognition that dental abscesses could spread to other parts of the body led to aggressive treatment protocols that emphasized early intervention. The surgical procedures available for dental treatment included tooth extraction, abscess drainage, and various repair techniques for damaged teeth. Egyptian dentists used specialized instruments designed for oral surgery, including forceps for tooth extraction, probes for examining tooth cavities, and cutting instruments for performing drainage procedures. The precision and effectiveness of these surgical techniques contributed to successful treatment outcomes. The materials used for dental restorations and repairs included various substances that could be shaped and hardened to restore tooth function and appearance. Gold wire was commonly used to stabilize loose teeth and hold dental restorations in place, while ivory and bone materials were carved to create artificial teeth. The selection and preparation of dental materials required considerable skill and knowledge of their properties and limitations. The oral hygiene practices promoted by Egyptian physicians included detailed guidelines for tooth cleaning, gum care, and dietary modifications that promoted oral health. Various preparations were available for cleaning teeth, including abrasive pastes that helped remove plaque and debris. Mouthwashes and rinses were used to treat gum inflammation and freshen breath. The emphasis on preventive oral care demonstrated an understanding of hygiene in maintaining dental health. The training provided to dental practitioners was comprehensive and specialized, involving instruction in oral anatomy, dental pathology, surgical techniques, and patient management. Students learned through observation and hands-on practice under the supervision of experienced dentists, gradually developing the skills necessary for independent practice. The specialized nature of dental training reflected the complexity of oral health care and the importance placed on dental expertise. The documentation maintained by Egyptian dentists included detailed records of dental conditions, treatment procedures, and outcomes that contributed to the advancement of dental knowledge. These records provided valuable information for evaluating treatment effectiveness and developing improved techniques. The systematic approach to dental documentation demonstrated the scientific orientation of Egyptian dental practice. The integration of dental care with general medical practice ensured that oral health problems were considered in the context of overall patient health. Physicians understood that dental infections could affect general health and that systemic conditions could influence oral health outcomes. This integrated approach to dental care represented a comprehensive understanding of the relationship between oral health and general medical conditions. Archaeological evidence has revealed numerous examples of ancient Egyptian dental work, including gold wire used to stabilize loose teeth and artificial teeth made from ivory or bone. Egyptian dentists understood the importance of oral hygiene and had developed toothpastes and mouthwashes using ingredients like ground pumice, mint, and various aromatic substances. They also performed tooth extractions using specialized instruments and had developed techniques for treating dental abscesses and infections. The treatment of broken bones was another area where Egyptian physicians excelled. They had developed sophisticated methods for setting fractures, immobilizing injured limbs, and promoting proper healing. The Edwin Smith Papyrus contained detailed descriptions of various types of fractures and the appropriate treatment for each. Egyptian physicians understood the importance of proper alignment in fracture healing and had developed traction devices and splinting techniques to maintain correct positioning during the healing process. The classification system for bone fractures developed by Egyptian physicians was remarkably comprehensive and precise, distinguishing between simple and compound fractures, displaced and non-displaced breaks, and fractures involving different anatomical locations. This classification system allowed physicians to select appropriate treatment approaches and predict healing outcomes based on fracture characteristics. The systematic approach to fracture classification demonstrated the sophisticated understanding of orthopedic principles that characterized Egyptian medical practice. The reduction techniques used to restore proper bone alignment involved careful manipulation of fractured bones to ensure optimal healing outcomes. Egyptian physicians understood that proper reduction was essential for restoring normal function and preventing long-term complications such as chronic pain or disability. The reduction procedures were performed using specific manual techniques that had been refined through generations of practice and experience. The immobilization methods developed by Egyptian physicians included various types of splints, casts, and traction devices designed to maintain proper bone alignment during the healing process. These devices were constructed using materials such as wood, linen, plant fibers, and hardening agents that provided rigid support while remaining relatively lightweight and comfortable. The design and construction of immobilization devices required considerable skill and knowledge of biomechanical principles. The traction techniques employed by Egyptian physicians involved the application of controlled forces to maintain bone alignment and promote proper healing. These techniques were particularly useful for treating fractures of long bones, where muscle contractions might cause displacement of fracture fragments. The traction systems used specialized pulleys, weights, and attachment devices that allowed for precise control of applied forces. The monitoring procedures used during fracture healing involved regular examination of injured limbs to assess healing progress and identify potential complications. Physicians checked for signs of infection, improper alignment, circulation problems, and other issues that might affect healing outcomes. This systematic monitoring allowed for early intervention when problems were identified and contributed to improved treatment results. The rehabilitation protocols developed for fracture patients addressed both physical and functional recovery aspects of bone healing. Egyptian physicians understood that immobilization, while necessary for proper bone healing, could lead to muscle weakness and joint stiffness if prolonged unnecessarily. They developed graduated exercise programs and mobilization techniques that promoted recovery while protecting healing tissues. The surgical interventions available for complex fractures included procedures for removing bone fragments, repairing soft tissue damage, and addressing complications such as infection or non-union. These surgical procedures required considerable skill and knowledge of anatomy, as well as specialized instruments designed for orthopedic surgery. The success rates achieved with these procedures demonstrated the advanced state of Egyptian surgical practice. The pain management approaches used during fracture treatment included both local and systemic medications that provided relief while allowing patients to participate in rehabilitation activities. Egyptian physicians understood that effective pain control was important for patient comfort and recovery, and they developed various analgesic preparations and administration techniques that provided optimal pain relief with minimal side effects. The nutritional support provided to fracture patients recognized the importance of proper nutrition in bone healing and recovery. Physicians recommended dietary modifications that provided essential nutrients for bone formation, including calcium-rich foods and other substances believed to promote healing. The attention to nutritional factors in fracture treatment demonstrated a comprehensive understanding of the healing process. The long-term follow-up care provided to fracture patients included ongoing assessment of healing outcomes, functional recovery, and potential late complications. Egyptian physicians understood that fracture treatment extended beyond initial bone healing and that patients might require ongoing care to achieve optimal long-term outcomes. This comprehensive approach to fracture care reflected the high standards of Egyptian orthopedic practice. The use of splints and casts was common in Egyptian medical practice. Physicians created rigid supports using wood, linen, and various hardening agents to immobilize fractured bones. Archaeological evidence has revealed numerous examples of successfully healed fractures, indicating that Egyptian orthopedic techniques were highly effective. Some mummified remains show evidence of complex fracture repairs that would be considered sophisticated even by modern standards. Egyptian medicine was not limited to physical ailments, but also addressed mental and emotional health. Physicians recognized that psychological factors could influence physical health and had developed various approaches for treating what we would now call psychosomatic disorders. They understood the connection between emotional stress and physical symptoms, implementing therapeutic approaches that addressed both the mental and physical aspects of illness. The understanding of mental health conditions in ancient Egypt was sophisticated and nuanced, recognizing that psychological distress could manifest in various ways and require different treatment approaches. Egyptian physicians identified what we might now call depression, anxiety, and other mental health conditions, developing treatment protocols that combined psychological support with medical interventions. The recognition of mental health as a legitimate medical concern demonstrated the advanced nature of Egyptian healthcare philosophy. The diagnostic approaches used for mental health conditions involved careful observation of patient behavior, mood, and cognitive function, combined with detailed questioning about life circumstances and recent experiences. Physicians were trained to recognize the signs and symptoms of various psychological conditions and to distinguish between temporary emotional distress and more serious mental health problems requiring intensive treatment. The therapeutic interventions available for mental health conditions included counseling and psychotherapy techniques that addressed underlying psychological issues and promoted emotional healing. Egyptian physicians developed systematic approaches to counseling that involved active listening, empathetic response, and guided problem-solving techniques. These therapeutic conversations were often conducted in peaceful, supportive environments that promoted relaxation and openness. The environmental therapy approaches used in Egyptian mental health treatment recognized the importance of surroundings and circumstances in promoting psychological well-being. Patients with mental health conditions were often treated in temple complexes that provided peaceful, beautiful environments conducive to healing and reflection. These therapeutic environments included gardens, water features, and artistic decorations that created calming, restorative atmospheres. The occupational therapy techniques employed by Egyptian physicians involved engaging patients in meaningful activities that promoted self-esteem, social connection, and cognitive stimulation. These activities might include artistic projects, religious ceremonies, physical exercise, or educational pursuits that helped patients regain confidence and purpose. The systematic use of meaningful activities in mental health treatment demonstrated an understanding of the therapeutic value of engagement and accomplishment. The social support systems developed for mental health patients recognized the importance of family and community connections in promoting psychological recovery. Egyptian physicians worked with families to provide education about mental health conditions and guidance on supportive care techniques. Community support networks were mobilized to provide ongoing assistance and encouragement during the recovery process. The pharmacological treatments available for mental health conditions included various plant-based preparations that provided calming, mood-stabilizing, or stimulating effects as needed. These medications were carefully selected and dosed based on individual patient characteristics and symptom patterns. The integration of pharmacological treatments with psychological interventions represented a comprehensive approach to mental health care. The spiritual healing techniques used in Egyptian mental health treatment recognized the connection between spiritual well-being and psychological health. Patients were often encouraged to participate in religious ceremonies, meditation practices, and other spiritual activities that provided comfort, meaning, and connection to larger purposes. The integration of spiritual elements into mental health treatment reflected the holistic philosophy that characterized Egyptian medicine. The rehabilitation programs developed for mental health patients addressed the practical aspects of returning to normal life activities and social roles. These programs provided graduated exposure to increasing levels of responsibility and social interaction, helping patients rebuild confidence and skills necessary for independent functioning. The systematic approach to rehabilitation demonstrated an understanding of the recovery process and the importance of gradual reintegration. The prevention approaches used in Egyptian mental health care emphasized the importance of maintaining psychological well-being through lifestyle choices, stress management, and social support. Physicians provided guidance on stress reduction techniques, healthy coping strategies, and lifestyle modifications that promoted mental health. The emphasis on prevention demonstrated a comprehensive understanding of mental health maintenance that extended beyond treatment of existing conditions. The concept of holistic medicine was central to Egyptian medical practice. Physicians considered the patient's entire life situation, including family relationships, occupation, diet, and spiritual beliefs when developing treatment plans. This comprehensive approach recognized that healing involved more than simply treating symptoms and required attention to all aspects of human experience. Egyptian physicians were organized into a hierarchical professional structure that resembled modern medical institutions. At the top were the chief physicians who served the pharaoh and royal family, followed by temple physicians who provided medical care within religious institutions, and finally the general practitioners who served the broader population. This organization ensured quality control and maintained professional standards throughout the medical community. Medical education in ancient Egypt was rigorous and comprehensive. Students began their training at a young age, often as apprentices to established physicians. The curriculum included anatomy, physiology, pharmacology, surgery, and clinical practice. Students were required to memorize extensive medical texts, learn to prepare various medicinal compounds, and demonstrate proficiency in diagnostic techniques and treatment procedures. The House of Life institutions served as both medical schools and research centers where new treatments were developed and existing knowledge was preserved and transmitted. These institutions maintained extensive libraries of medical papyri and employed scribes who were responsible for copying and updating medical texts. The combination of education, research, and clinical practice created a dynamic environment that fostered medical advancement and innovation. Egyptian physicians maintained detailed medical records, documenting patient histories, treatment outcomes, and the effectiveness of various therapeutic interventions. This systematic approach to medical record-keeping allowed physicians to track the progress of their patients, evaluate the success of different treatments, and refine their therapeutic approaches based on accumulated experience. The concept of medical specialization was well developed in ancient Egypt. Physicians often focused on particular areas of practice, such as surgery, internal medicine, gynecology, or dentistry. This specialization allowed practitioners to develop deep expertise in their chosen fields and provided patients with access to highly skilled specialists for complex medical problems. Women played important roles in Egyptian medicine, serving as physicians, midwives, and healers. The most famous female physician was Merit Ptah, who lived during the Old Kingdom and was described as chief physician in inscriptions. Female physicians were particularly involved in gynecology and obstetrics, areas where their expertise was especially valued. The respect accorded to female medical practitioners in ancient Egypt was unusual for the ancient world and reflected the relatively egalitarian nature of Egyptian society. The training opportunities available to women in Egyptian medicine were extensive and comparable to those provided to male practitioners. Female medical students attended the same institutions, studied the same curriculum, and received the same rigorous preparation for medical practice. This educational equality was remarkable for the ancient world and contributed to the high level of medical expertise achieved by Egyptian female physicians. The specialization areas where women were particularly prominent included gynecology, obstetrics, pediatrics, and various aspects of preventive medicine and health maintenance. Female physicians often developed particular expertise in conditions affecting women and children, areas where their understanding and empathy were especially valued by patients and families. The specialization of female physicians contributed to improved healthcare outcomes in these important areas. The professional recognition accorded to female physicians in Egyptian society was demonstrated through various forms of official acknowledgement, including titles, inscriptions, and positions of responsibility within medical institutions. Female physicians could achieve high rank within the medical hierarchy and were respected for their knowledge and skill by both colleagues and patients. This professional recognition reflected the merit-based nature of Egyptian medical practice. The research and scholarly contributions made by female physicians included participation in medical education, development of new treatment techniques, and documentation of clinical observations. Female physicians contributed to the advancement of medical knowledge through their clinical experience and scholarly activities, helping to expand understanding of various medical conditions and treatment approaches. The patient care provided by female physicians was often characterized by particular attention to holistic aspects of health and healing, including emotional support, family dynamics, and social factors that might influence health outcomes. Female physicians often developed strong therapeutic relationships with their patients and were known for their compassionate, comprehensive approach to medical care. The leadership roles assumed by female physicians included positions as heads of medical departments, supervisors of medical training programs, and advisors to government officials on public health matters. These leadership positions demonstrated the confidence that Egyptian society placed in the abilities of female medical practitioners and their capacity to contribute to medical administration and policy development. The international influence of Egyptian female physicians extended beyond Egypt's borders, as female practitioners traveled to other countries as diplomatic advisors, medical consultants, and teachers. The reputation of Egyptian female physicians was known throughout the ancient Mediterranean world, and their expertise was sought by foreign rulers and medical institutions. The mentorship relationships developed by female physicians included both teaching younger women entering medical practice and collaborating with male colleagues on complex cases and research projects. These professional relationships contributed to the advancement of medical knowledge and helped ensure the continued success of women in Egyptian medical practice. The documentation maintained by female physicians included detailed clinical records, case studies, and research observations that contributed to the overall body of Egyptian medical literature. Female physicians were active participants in the scholarly traditions of Egyptian medicine and helped preserve and transmit medical knowledge to future generations. The social impact of female physicians extended beyond their direct medical practice to include influence on social attitudes toward women's capabilities and contributions to society. The success of female physicians helped demonstrate women's intellectual abilities and professional competence, contributing to the relatively egalitarian nature of Egyptian society and the opportunities available to women in various fields. Accorded to female medical practitioners in ancient Egypt was unusual for the ancient world and reflected the relatively egalitarian nature of Egyptian society. The treatment of gynecological and obstetric conditions was a well-developed aspect of Egyptian medicine. Physicians had extensive knowledge of female anatomy and reproductive physiology, developing sophisticated treatments for various conditions affecting women's health. The Kahun gynecological papyrus, dating to around 1800 BCE, contained detailed descriptions of gynecological conditions and their treatments, demonstrating the advanced state of women's healthcare in ancient Egypt. Egyptian physicians understood the process of childbirth and had developed various techniques to assist with difficult deliveries. They recognized the signs of normal and abnormal labor and had procedures for managing complications. The use of birthing stools and various positioning techniques helped facilitate delivery, and physicians had developed methods for treating postpartum complications. Contraception and family planning were also addressed in Egyptian medical practice. Physicians had developed various contraceptive methods using pessaries, douches, and oral preparations designed to prevent pregnancy. While the effectiveness of these methods varied, their existence demonstrated that Egyptian society recognized the importance of reproductive choice and had developed medical responses to meet these needs. The treatment of infectious diseases was a significant challenge for Egyptian physicians who lacked understanding of microbial causation, but nevertheless developed effective approaches for managing many communicable conditions. They recognized that certain diseases were contagious and implemented isolation procedures to prevent spread. The use of fumigation, quarantine, and disinfection demonstrated their practical understanding of disease transmission even without knowledge of the underlying mechanisms. The recognition of contagious diseases by Egyptian physicians was based on careful observation of disease patterns and transmission routes. They noticed that certain illnesses seemed to spread from person to person through close contact, while others appeared to be associated with specific environmental conditions or seasonal patterns. This observational approach allowed them to develop practical strategies for disease control even without understanding the microbial basis of infection. The isolation procedures implemented by Egyptian physicians were surprisingly sophisticated and effective. When infectious diseases were identified, affected individuals were separated from the general population and housed in designated facilities where they could receive appropriate care while minimizing the risk of transmission. These isolation facilities were staffed by specially trained attendants who followed strict protocols for preventing the spread of disease. The fumigation techniques used by Egyptian physicians involved the burning of various aromatic substances that were believed to purify the air and eliminate disease-causing influences. While the scientific basis for these practices was not understood at the time, many of the substances used actually possessed antimicrobial properties that may have contributed to their effectiveness. The systematic application of fumigation in medical facilities and private homes demonstrated a comprehensive approach to infection control. The quarantine measures implemented during disease outbreaks were well organized and strictly enforced, involving the restriction of movement into and out of affected areas until the outbreak was contained. These measures included the establishment of checkpoints, the monitoring of travelers, and the implementation of waiting periods before individuals could enter unaffected areas. The effectiveness of these quarantine measures contributed to the control of various epidemic diseases. The disinfection procedures used by Egyptian physicians involved the systematic cleaning and treatment of contaminated materials, surfaces, and facilities. These procedures included the use of various chemical agents, heat treatment, and physical removal of contaminated materials. While the scientific principles underlying disinfection were not fully understood, the practical effectiveness of these methods was recognized through experience and observation. The treatment of specific infectious diseases often involved combination approaches that addressed both the symptoms and the underlying condition. For diseases characterized by fever and weakness, physicians used cooling treatments, dietary modifications, and medicinal preparations designed to support the patient's natural healing processes. For conditions involving skin lesions or respiratory symptoms, they employed topical treatments and inhalation therapies that provided symptomatic relief. The management of epidemic diseases required coordinated, community-wide responses that involved multiple levels of authority and various types of medical practitioners. Public health officials worked with physicians, priests, and community leaders to implement comprehensive disease control measures that addressed both individual treatment needs and population-level prevention strategies. These coordinated responses were often remarkably effective in controlling disease outbreaks. The documentation of infectious disease patterns and treatment outcomes provided valuable information for understanding disease behavior and improving treatment approaches. Physicians maintained detailed records of disease outbreaks, including information about transmission patterns, symptom progression, and treatment effectiveness. This systematic documentation contributed to the development of more effective approaches to infectious disease management. The training provided to medical practitioners for managing infectious diseases emphasized both practical treatment skills and infection control procedures. Physicians learned to recognize the early signs of various infectious diseases, to implement appropriate isolation and treatment measures, and to protect themselves and others from disease transmission. This specialized training was essential for maintaining effective medical care during disease outbreaks. Egyptian physicians developed sophisticated treatments for various skin conditions, including infections, inflammations, and parasitic infestations. They used topical preparations containing antimicrobial substances and had developed techniques for removing foreign objects and treating wounds. The hot, dry climate of Egypt created particular challenges for skin health, and physicians had adapted their treatments to address these environmental factors. The management of eye diseases was particularly important in ancient Egypt due to the prevalence of various ocular conditions in the desert environment. Sand, dust, and intense sunlight created numerous problems for eye health, and Egyptian physicians had developed specialized treatments for various eye conditions. They used eye drops, ointments, and surgical procedures to treat infections, injuries, and other ocular problems. The ancient Egyptians had developed sophisticated techniques for managing pain and providing anesthesia during medical procedures. They used various plant-based preparations that contained analgesic compounds, including opium derivatives and other psychoactive substances. These pain management techniques allowed physicians to perform complex procedures while minimizing patient discomfort. The concept of medical ethics was well developed in Egyptian medical practice. Physicians were bound by professional codes that emphasized patient welfare, competent practice, and honest dealing with patients and their families. These ethical guidelines were similar in many respects to modern medical ethics and demonstrated the mature development of Egyptian medical culture. The integration of rational medicine with religious and spiritual beliefs was characteristic of Egyptian medical practice. While Egyptian physicians employed scientific observation and logical reasoning in their approach to disease, they also recognized the importance of spiritual and psychological factors in healing. This integration created a comprehensive approach to healthcare that addressed both the physical and metaphysical aspects of human experience. The philosophical foundations of Egyptian medicine recognized the interconnectedness of physical, mental, and spiritual health, viewing illness as a disruption of the natural harmony that existed between these different aspects of human existence. This holistic perspective influenced all aspects of medical practice, from diagnosis and treatment to prevention and recovery. Physicians were trained to consider the complete context of each patient's life when developing treatment plans. The spiritual aspects of Egyptian medical practice were not merely superstitious additions to otherwise rational treatments, but rather integral components of a comprehensive healing system. Physicians understood that patient beliefs, emotional states, and spiritual well-being could significantly influence the effectiveness of medical treatments. They incorporated prayers, rituals, and spiritual counseling into their practice as therapeutic interventions rather than mere ceremonial observances. The psychological components of Egyptian medical practice reflected an understanding of the mind-body connection that was remarkably advanced for its time. Physicians recognized that emotional stress, mental distress, and psychological trauma could manifest as physical symptoms and could influence the course of organic diseases. They developed various approaches for addressing psychological factors, including counseling, relaxation techniques, and environmental modifications designed to promote mental well-being. The role of priests in Egyptian medical practice was complex and multifaceted, involving not only spiritual guidance, but also practical medical training and clinical expertise. Many priest-physicians had received the same rigorous medical education as their secular counterparts and were fully qualified to provide sophisticated medical care. The combination of medical knowledge with spiritual authority often enhanced their effectiveness as healers. The temple medical centers served as comprehensive healthcare facilities that integrated medical treatment with spiritual healing in carefully designed environments that promoted recovery and well-being. These centers featured specialized treatment areas, medicinal gardens, meditation spaces, and accommodation for patients who required extended care. The holistic environment created by temple medical centers was recognized as an important factor in patient recovery. The diagnostic approaches used in Egyptian medicine included assessment of spiritual and psychological factors alongside physical examination findings. Physicians inquired about dreams, emotional states, relationships, and spiritual concerns as part of their standard evaluation procedures. This comprehensive assessment allowed them to identify factors that might influence treatment outcomes and to develop more effective therapeutic approaches. The treatment protocols used by Egyptian physicians often combined medical interventions with spiritual and psychological support measures. A patient with a physical ailment might receive medicinal preparations, dietary recommendations, and lifestyle modifications, along with spiritual counseling, prayer, and participation in healing rituals. This multifaceted approach addressed all aspects of the patient's condition and promoted comprehensive healing. The training provided to Egyptian physicians included instruction in spiritual and psychological healing methods alongside traditional medical subjects. Students learned to recognize the signs of spiritual distress, to provide appropriate counseling and support, and to incorporate spiritual practices into their medical treatments. This comprehensive training prepared physicians to address the full range of human healing needs. The evaluation of treatment outcomes in Egyptian medicine considered spiritual and psychological improvements alongside physical recovery. Physicians assessed not only the resolution of symptoms, but also improvements in patient mood, spiritual well-being, and overall quality of life. This comprehensive evaluation approach provided a more complete picture of treatment effectiveness and guided the development of improved therapeutic approaches. Temple medicine played an important role in Egyptian healthcare, with many temples serving as medical centers where physician priests provided treatment for various conditions. These institutions combined medical practice with religious ritual, creating healing environments that addressed both the physical and spiritual needs of patients. The Temple of Imhotep at Memphis was particularly renowned for its medical services and attracted patients from throughout the Mediterranean world. The preservation and transmission of medical knowledge was a crucial aspect of Egyptian medical culture. The careful copying and recopying of medical papyri ensured that accumulated knowledge was passed down through generations of physicians. This commitment to preserving medical knowledge created a continuous tradition of learning that spanned thousands of years and contributed to the advancement of medical science. Trade and cultural exchange played important roles in the development of Egyptian medicine. Egyptian physicians had contact with medical practitioners from other cultures, including Mesopotamian, Nubian, and later Greek traditions. This exchange of knowledge and techniques contributed to the sophistication of Egyptian medical practice and influenced medical development throughout the ancient world. The economic aspects of medical practice in ancient Egypt were well regulated, with established fee structures and payment systems for medical services. Physicians were compensated according to their skill level and the complexity of the services they provided. The wealthy could afford private physicians and complex treatments, while public health measures ensured that basic medical care was available to all social classes. The influence of Egyptian medicine extended far beyond the borders of Egypt itself. Greek physicians, including Hippocrates, studied Egyptian medical texts and techniques, incorporating many Egyptian innovations into their own practice. The Library of Alexandria served as a center for medical learning that preserved and disseminated Egyptian medical knowledge throughout the Hellenistic world. The transmission of Egyptian medical knowledge to other cultures occurred through various channels, including diplomatic exchanges, trade relationships, military campaigns, and scholarly visits. Egyptian physicians served as advisors to foreign rulers, traveled as diplomatic ambassadors, and taught in medical schools throughout the ancient Mediterranean world. These interactions facilitated the spread of Egyptian medical innovations to distant lands and cultures. The translation of Egyptian medical texts into other languages was a crucial factor in the preservation and dissemination of Egyptian medical knowledge. Greek scholars working in Alexandria translated many important Egyptian papyri into Greek, making this knowledge accessible to a broader audience of medical practitioners. These translations were subsequently copied and distributed throughout the Greek-speaking world, ensuring the survival of Egyptian medical wisdom. The adaptation of Egyptian medical techniques to local conditions and cultural contexts occurred as this knowledge spread to different regions and societies. Local physicians modified Egyptian approaches to incorporate indigenous healing traditions, local medicinal plants, and cultural preferences while preserving the essential principles and methods that made Egyptian medicine so effective. This adaptation process created hybrid medical traditions that combined the best elements of different healing systems. The establishment of medical schools based on Egyptian models occurred in various locations throughout the ancient world, creating institutions that preserved and transmitted Egyptian medical knowledge to new generations of practitioners. These schools maintained libraries of translated Egyptian texts, employed teachers trained in Egyptian methods, and produced graduates who carried Egyptian medical principles to their own communities and practices. The influence of Egyptian surgical techniques was particularly significant in the development of surgery throughout the ancient world. The precision instruments, systematic procedures, and comprehensive training methods developed in Egypt were adopted by surgeons in other cultures, leading to improvements in surgical outcomes and the expansion of surgical capabilities. Egyptian surgical innovations continued to influence surgical practice for many centuries after the decline of Egyptian political power. The pharmacological knowledge developed by Egyptian physicians contributed significantly to the development of medicine in other cultures. The extensive cataloging of medicinal plants, the sophisticated preparation methods, and the systematic approach to dosage and administration developed in Egypt provided a foundation for pharmaceutical development throughout the ancient world. Many Egyptian remedies continued to be used in modified forms for thousands of years. The diagnostic methods pioneered by Egyptian physicians influenced medical practice throughout the Mediterranean region and beyond. The systematic approach to patient examination, the emphasis on careful observation and documentation, and the logical methods for correlating symptoms with underlying conditions became standard practices in many medical traditions. These diagnostic principles remain fundamental to medical practice today. The public health measures developed in Egypt served as models for other ancient civilizations seeking to improve the health of their populations. The comprehensive approach to sanitation, water supply management, food safety, and disease prevention developed in Egypt was adapted and implemented in various forms throughout the ancient world. These public health innovations contributed to improved health outcomes in many societies. The medical ethics and professional standards established by Egyptian physicians influenced the development of medical professionalism in other cultures. The emphasis on patient welfare, competent practice, honest communication, and continuing education that characterized Egyptian medical practice provided a model for medical professionalism that was adopted and adapted by medical practitioners throughout the ancient world. During the Ptolemaic period, Egyptian medical knowledge was synthesized with Greek philosophical approaches to create new hybrid traditions that influenced medical development throughout the Mediterranean region. This cultural fusion created opportunities for medical advancement while preserving the core insights of traditional Egyptian practice. The Roman conquest of Egypt brought new challenges and opportunities for Egyptian medical practice. Roman administrators recognized the value of Egyptian medical knowledge and incorporated many Egyptian techniques into Roman military medicine. Egyptian physicians served throughout the Roman Empire, spreading their knowledge and techniques to distant provinces. The decline of traditional Egyptian culture during the Christian and Islamic periods led to changes in medical practice, but many Egyptian medical innovations continued to influence healing traditions throughout North Africa and the Middle East. Islamic scholars preserved and translated many Egyptian medical texts, ensuring that this knowledge remained available for future generations. Archaeological research has revealed extensive evidence of Egyptian medical practice, including surgical instruments, medical papyri, and mummified remains that show evidence of medical treatment. These discoveries have confirmed many of the claims made in ancient texts and have revealed additional information about the sophistication of Egyptian medical practice. Modern medical historians recognize ancient Egypt as one of the foundational civilizations in the development of rational, scientific medicine. The systematic approach to observation, diagnosis, and treatment developed by Egyptian physicians established principles that continue to guide medical practice today. The emphasis on detailed record-keeping, professional education, and ethical practice created a model for medical professionalism that remains relevant in contemporary healthcare. The pharmacological knowledge of ancient Egyptian physicians has been validated by modern scientific research, which has confirmed the therapeutic properties of many traditional Egyptian remedies. This validation has led to renewed interest in traditional healing knowledge and has contributed to the development of new therapeutic approaches based on ancient wisdom. The surgical techniques developed by Egyptian physicians were remarkably advanced, and in many cases were not surpassed until the modern era. The precision and skill demonstrated in ancient surgical procedures provide evidence of the high level of medical expertise achieved in ancient Egypt. The holistic approach to healthcare pioneered by Egyptian physicians, which considered psychological, social, and spiritual factors in addition to physical symptoms, has gained new relevance in contemporary medicine. Modern healthcare increasingly recognizes the importance of treating the whole person rather than simply addressing isolated symptoms. The professional organization of Egyptian medicine, with its emphasis on education, specialization, and quality control, provided a model for medical professionalism that influenced subsequent medical traditions throughout history. The institutional structures developed in ancient Egypt established precedents for medical education and practice that continue to shape healthcare delivery today. As we conclude this extensive exploration of ancient Egyptian medicine, it becomes clear that the contributions of these ancient physicians were far more significant and sophisticated than previously understood. Their systematic approach to medical education, their detailed anatomical knowledge, their sophisticated surgical techniques, and their comprehensive pharmacological understanding established foundations for medical practice that continue to influence healthcare today. The comprehensive nature of Egyptian medical practice encompassed virtually every aspect of healthcare that we recognize today, from preventative medicine and public health to complex surgical procedures and pharmaceutical interventions. The breadth and depth of their medical knowledge demonstrates that ancient civilizations were capable of developing sophisticated understanding of human health and disease through systematic observation, logical reasoning, and careful experimentation. The professional organization of Egyptian medicine created a model for medical practice that emphasized education, specialization, quality control, and ethical conduct. This professional structure ensured that medical knowledge was preserved and transmitted effectively while maintaining high standards of patient care. The institutional frameworks developed in ancient Egypt provided templates for medical organization that continued to influence healthcare delivery for thousands of years. The scientific approach to medicine, pioneered by Egyptian physicians, established principles of observation, documentation, and evidence-based practice that remain fundamental to effective healthcare today. Their commitment to systematic investigation and logical reasoning created a foundation for medical science that supported continuous improvement and advancement in medical knowledge and techniques. The holistic perspective on health and healing that characterized Egyptian medicine recognized the importance of addressing physical, mental, and spiritual aspects of human well-being. This comprehensive approach to healthcare acknowledged the complexity of human experience and the multiple factors that influence health outcomes. The integration of rational medical practice with attention to psychological and spiritual factors created a model for patient care that remains relevant in contemporary healthcare. The technological innovations developed by Egyptian physicians and medical craftsmen produced surgical instruments, diagnostic tools, and therapeutic devices that were remarkably sophisticated for their time. The precision and functionality of these medical technologies reflected the high standards of Egyptian craftsmanship and the practical needs of medical practice. Many of these innovations continued to influence medical technology development for centuries. The pharmacological knowledge accumulated by Egyptian physicians created one of the world's first comprehensive pharmaceutical systems, with standardized preparations, quality control measures, and systematic approaches to drug development and testing. This pharmaceutical tradition established principles of medicinal practice that continued to guide drug development and therapeutic intervention throughout history. The public health measures implemented by Egyptian authorities demonstrated an understanding of population health that was remarkably advanced for its time. The comprehensive approach to sanitation, disease prevention, and health promotion developed in ancient Egypt provided models for public health practice that influenced community health efforts throughout the ancient world and beyond. The medical literature produced by Egyptian physicians created a systematic body of medical knowledge that served as a foundation for medical education and practice throughout the ancient world. The careful documentation of medical observations, treatment protocols, and case studies established precedents for medical literature that continued to influence medical communication and knowledge transmission. The international influence of Egyptian medicine extended throughout the ancient Mediterranean world and beyond, contributing to medical development in numerous cultures and civilizations. The widespread adoption and adaptation of Egyptian medical knowledge demonstrates the universal value of their insights and innovations in addressing fundamental human health needs. The archaeological evidence that continues to be discovered provides ongoing validation of the sophistication and effectiveness of ancient Egyptian medical practice. Modern analysis of mummified remains, surgical instruments, and medical facilities confirms many of the claims made in ancient texts and reveals additional evidence of the remarkable achievements of Egyptian physicians. The legacy of Egyptian medicine in modern healthcare is evident in numerous aspects of contemporary medical practice, from diagnostic methods and surgical techniques to pharmaceutical principles and professional organization. The fundamental approaches to patient care, medical education, and healthcare delivery developed in ancient Egypt continue to guide medical practice today. The reality of ancient Egyptian medicine challenges many misconceptions about ancient healing practices and demonstrates that rational, scientific approaches to healthcare developed much earlier than commonly believed. The physicians of ancient Egypt were not primitive healers relying solely on superstition and magic, but rather skilled practitioners who employed systematic observation, logical reasoning, and evidence-based treatment approaches. The preservation of Egyptian medical knowledge in papyrus texts has provided modern scholars with unprecedented insight into ancient medical practice and has revealed the remarkable sophistication of early healthcare systems. This knowledge continues to inform contemporary medical practice and contributes to our understanding of the historical development of healthcare. The continuous tradition of medical learning and improvement that characterized Egyptian medical practice established patterns of professional development that continue to guide medical education and practice today. The commitment to preserving and transmitting medical knowledge while continuously seeking to improve understanding and techniques created a dynamic tradition of medical advancement that serves as a model for contemporary healthcare development. The humanitarian values that motivated Egyptian physicians in their dedication to healing and patient care reflect universal human concerns that transcend cultural and temporal boundaries. The compassion, skill, and commitment demonstrated by these ancient healers continues to inspire contemporary healthcare providers and reminds us of the noble purposes that guide medical practice. As we reflect on this journey through the medical practices of ancient Egypt, we can appreciate the dedication, skill, and innovation of these early healthcare providers who laid the groundwork for modern medicine. Their contributions remind us that the pursuit of healing is a fundamental human endeavor that transcends time and culture, connecting us across millennia in the shared goal of alleviating suffering and promoting health. The story of ancient Egyptian medicine is ultimately a story of human ingenuity and compassion, demonstrating how successive generations of healers built upon the knowledge of their predecessors to create increasingly sophisticated approaches to healthcare. This tradition of continuous learning and improvement continues today as modern physicians build upon the foundations established by their ancient Egyptian colleagues thousands of years ago. In closing, the reality of ancient Egyptian medicine reveals a rich tradition of scientific inquiry, professional excellence, and humanitarian service that deserves recognition as one of humanity's great intellectual achievements. The physicians of ancient Egypt established standards of medical practice that remain relevant today, and created a legacy of healing that continues to inspire and inform contemporary healthcare. As we turn off our lights and prepare for rest, we can appreciate the timeless dedication of healers throughout history, who have devoted their lives to the noble pursuit of medicine. And we can say goodnight, knowing that this ancient tradition of caring continues to guide healthcare providers around the world today. Good night.